a lot of fear and misunderstanding of what AI's capability is. But I think it's essential for people to start using it to understand for themselves. For some people, it would work. For some people, it won't. But start using it and use it for the right purposes. You don't need to change the world immediately with AI, but apply AI slowly in different aspects of life, and trust me, you would see a difference.
Welcome to the Health Beats podcast, brought to you by the inaugural Abu Dhabi Global Healthcare Week. The Health Beats podcast series is your window into healthcare industry news making headlines and the role of Abu Dhabi and the UAE in unlocking global healthcare momentum. We give you an insight into the future of the global healthcare sector and Abu Dhabi's contribution to it. I'm your host, Lara Satrakian, and in this week's episode, I'm joined by Ashish Koshy, Group Chief Operating Officer at M42. Our conversation today is entitled AI's Potential in Healthcare, a Visionary Perspective. Ashish, welcome to the podcast.
Thank you so much, Laura, and thank you for having me on this podcast.
There is so much to talk about and so much that you're doing. Can you start big picture? Give us your vision for the future of healthcare delivery. How is AI going to shape it, change it? What are we seeing already, and how does it impact the overall care journey?
Perfect question, and I'll probably take a step back before I talk about the vision. I think it's best to just understand where we are in healthcare right now. The traditional approach to healthcare has to change. Healthcare is continuously being more expensive and the costs are rising globally. The average GDP for healthcare is roughly around 10% here, roughly 20% in the US. And the world is experiencing a large shortage of healthcare workers across. And I think by 2030 is roughly around 10 million healthcare workers. Now let's talk vision. How do we think about health holistically? It shouldn't be just about healthcare. We're too late if you're just thinking about just care alone. And I think the biggest opportunities are in preventive, precise, and personalized healthcare solutions. And that's exactly the vision why M42 was born. And that's the vision of the future of healthcare delivery, at least from our perspective. Now, going back into the crux of the question of how AI can potentially shape patient experience and overall care journey, I think it's in multiple sectors. And I can give you some examples how M42 is also actually doing that. One, personalized care. As you're aware that M42 together with the Department of Health is running one of the largest genome programs in the world, currently sequenced over 500,000 population. It's not just about building the large data set. How do you apply AI and technologies and push that back into the population to drive personalized medicine? We've launched something called the Pharmacogenomics Initiative, which actually ensures that every participant of the genome program actually understands, based on its genomics, what pharma drugs works for it. Here is a clear example of using data, using AI, and pushing it back into the patient. A second sector is specifically on the diagnosis. There's a ton of AI solutions specifically on the imaging aspect, but how do you apply AI for the right use case? We have a facility called Capital Health Screening, which is a high throughput screening facility to test for anomalies in TB detections using X-rays. We deployed models so that the radiologists can focus on the problematic areas, and the rest of the images it's just a yes or no through the AI imaging. Here's a second example of how we can take an imaging solution and deploy into healthcare delivery. Third, I think is specifically on the patient experience and specifically from a physician perspective. We've launched one of the only open access large language model which has passed the US MLE. It has crossed over 72%, and now our target is to actually more and enhance it. Right now, physicians leveraging the MET42, which is the large language model, is actually, they can use it and they can understand what best works for the patient, specifically from this historical results. And from a patient perspective, when you get a report, or be it a genomics report, it's 228 pages long. You don't need to wait for a physician to break it down. You can ask the right questions using the large language model, not to take any drastic clinical decisions, but at least from a understanding of what works for you, so that when you spend that 5 minutes with the physician in our facility, it's a meaningful conversation. Second, Med42 also supports automation of clinical notes. So we understand, since we are a large entity which has physicians uh, in our payroll, we are seeing that considerable amount of time physicians are actually typing clinical notes when they should be actually spending time with the patients. How do you apply AI and large language models to automate that particular task? That itself is increasing productivity and also from a patient experience perspective. And last but not least, I think a key differentiator specifically in our vision or the future of healthcare delivery should be on leveraging remote monitoring devices or even wearables. Yes, you can understand an individual's health risks based on his biomarkers. Yes, you can understand his predisposition based on the genomics, but the environment and the lifestyle factor, that's critical. And connecting these three pillars, I think, is critical for any sort of future or vision for healthcare.
There's a lot there. There's problem solving. There's a certain design toward prevention or precision care and all these things. You're sort of setting the very, very big ideas out, and it seems like that technology is following those into execution. So how does that look like specifically in the preventive and personalized healthcare solutions?
So specifically, I can talk about how M42 is actually deploying it. You mentioned preventive and personalized. Personalized medicine, I want to go back to it's not just an idea, it's an actual living implementation of pharmacogenomics, where you have every individual that has actually participated in the genomics initiative. And right now, if he goes to a physician on the portal, his pharmacogenomics report is there. So that's a clear example of deployment from data generation to applying AI and actually pushing towards precision medicine. Second, I think in predictive analytics, we are fortunate to have a large team of AI applied scientists together working with physicians. And that, I think, is our differentiator compared to other entities. We're not just a healthcare delivery partner, but we're also an AI company. And that allows us to build specific models for multiple use cases on the predictive analytics use case. It could be on patient stratification. It could be on revenue assurance. Multiple use cases are there specifically on the predictive analytics space. I go back again on early disease detection. Right now, you have the technology and the data set to actually understand and proactively identify people who are at risk. And that's critical to ensure that people stay away from hospitals and we focus specifically on the healthcare of individuals. So there's multiple use cases of driving AI use cases on individual patients from a personalized and preventative healthcare basis.
Reading your own genome and applying preventive measures up front, essentially. AI that enables you to do that. As you apply these technologies, refine these technologies, what are some of the challenges in developing AI-driven diagnostic tools, both in terms of accuracy and reliability, false positives, all of it?
So there are a number of factors. I mean, the listics is considering that we've built this from ground up. I'll just try to touch upon some of the critical factors. Data quality and diversity, that's critical. The accuracy of your AI model heavily depends on how good the data is and how diverse the data set for training. And also on the quantum of the size, how large the data set. It should be representative, ideally, of the general population, irrespective of age, gender, ethnicities, and other medical histories. Critically, if you don't have that high level of data quality or any sort of other biased data sets, it can potentially lead to inaccurate prediction. And that's essentially that we are working with, it's essential to work with large, high quality data sets. Second, not just after you have built a model with the assumption on high, large data quality, I think the validation and testing process is something which is super critical. AI algorithms.
How do you approach that? And what have you learned?
Yeah, absolutely. I think that's a great question. That's why I think it's an essential collaborative piece for other AI companies to work hand in hand with the physician, with the healthcare delivery. You cannot just build AI algorithms in silo without ensuring and validating it actually performs well in real world settings. And that's how I think, again, I go back to the point of why M42 is unique, because we have the capability to build these models, but to actually validate it with physicians in a real clinical settings. And then ensure not just testing it, to ensure go back and we have a continuous feedback loop back into the model to understand where the inaccuracies are. So that's a critical step for any sort of model, especially in the healthcare space, to be pushed into the clinical setting. Then third, I think you need the regulatory compliance, because it's critical that we are deploying this model based on, at least in the region, based on the Department of Health or the Dubai Health Authority, any sort of regulations to ensure that the right data sets are being used for the right purposes. I mentioned integration to clinical workflows. And most importantly, I think something that's missed across in some of the models that we see across here is the openness of explainability. When it comes to a conclusion in terms of an analysis or an answer, it should be easily traceable back to why the model came up with that result. And that's one of the reasons why Med42, we've actually, when we push out results, we have references put across there. And that was a feedback that came in from our physicians. We've passed the USMLE, but how do you ensure that these results are referenced back to accurate scientific literature? And what we've put it across is we've actually referenced that across here. I think these are the critical challenges that any sort of AI company that needs to want to deploy these models in a clinical setting needs to go through. And then obviously the last factor is the cost and accessibility of compute. That's a common problem across the world.
Giving your AI a report card afterwards, it sounds like, if I had to boil it down. What was right, what was wrong? How does M42 approach, is that essentially it? Are you telling your AI where it was right and wrong being a big part of this?
Yeah, so I wouldn't say look at it from a right or wrong perspective, but I think it's a continuous learning perspective. Every prompt or every engineering task that the team is being built is based on the feedback that we have from the physicians, and it's a continuous learning process. And the goal is to hit a stage where this can be validated in the right stage using the right best practices methodology.
So how do you approach the integration of AI in healthcare services while maintaining patient trust, ethical standards, comfort levels, both in the practice and in the explanation to the patient? This is all very new to everyone. How do you bring the patient on board?
Yeah, I think number one is education and awareness. That's one. And also from a transparent basis, one of the reasons you would see that our model, which is Med42, is downloadable on Hugging Face. It's open access. It's not a closed model. That's one of the key factors in terms of educating the patients and physicians. This is an open model. We want everyone to collaborate together to actually make it a success. So that's number one, of being transparent in our AI practices. I think second is within M42, since we see patients, for us, the commitment to data privacy and security is critical. We handle patient data care as patient data with utmost care, following all the regulations in terms of GDPR compliance, HIPAA compliance, and the local authorities. How do we ensure that you have a workflow that integrates this back into hospitals in the right method, and hence a clear ethical AI framework? That's essential there. Second, goes back to the point that I mentioned earlier. I think the stakeholder engagement, it is essential if you want to deploy AI models into the real world use cases of clinical workflow. It needs to be done together with the physicians, with the nurses who are actually living and breathing healthcare in the hospitals. Deploying these models in silo will not get you anywhere. It is essential that we get them on board. Number one, to train the model and to understand where the inefficiencies are. Second, to ensure that they use it for the right reasons. AI is not going to replace any physician or a nurse, but it's going to augment their decision making. And that's the place where we want to be, ensuring we have the right models so that physicians take the right decisions, patients understand the data in a much more better way. And then the last step, I think, how we are integrating is, as I mentioned, the continuous learning and improvement.
I want to jump more into the ethical principles, because this is something the whole world is trying to figure out when it comes to AI. Can you share more about M42's approach to AI development? How do you balance innovation with responsible AI practices? And what have you learned that might be interesting to people even in other fields?
So it's essential that when you start on a journey, you start with certain factors, especially in the AI building or model building phase. I think it's transparency, ensuring that the AI systems are understandable to those who use them and those who are affected by the decisions. This also includes disclosing how the AI models are being developed, and that's why we have even published a paper how we are actually building this. So transparency is key. Second is fairness. It's essential that we ensure that the model is based on a data set that captures the entire population. Just because it's trained on a small population, say North America, it's not necessary. It can be deployed in a large setting. And hence, it's critical that any sort of AI model needs to be a global effort of collaborating as opposed to one entity building a model in silo there. And that's why it's essential in M42's principle that we go open access on this. Third, I think, is it's an education and awareness and being transparent to our stakeholders is we have the right mechanisms of safeguarding this data set using AI. And that's critical. And that is an ongoing journey, both with the physician and the patient, and we do it continuously or on every quarter to talk about how this is being handled in the right way. And the last, I think, is bringing everyone on board. I think it's essential. It's not just built by the AI engineers, but it's actually built collectively as a team for solving real-world health problems.
Any more examples? You shared quite a few, but any that come to mind of AI-powered initiatives, partnerships that have already impacted healthcare delivery in very concrete terms, whether specific disease areas or other use cases? Where are we really seeing this in practice already?
Some great partnership examples really off the presses. Yesterday, we announced a huge partnership with AstraZeneca, specifically in oncology diagnostics using AI to actually support breast cancer sequencing in women. That's a huge example of two large entities, M42 and AstraZeneca, coming together in this region to solve a humongous problem for this region, specifically affecting women here. Second, Microsoft, as you know, is a strong partner with M42, and we're working with them together on multiple use cases. In the healthcare delivery space, we are leveraging some of the tools on Azure because, again, I want to go back to partnership is critical for solving healthcare problems. And the third, I think, partnership we are happy to share is our partnership with the Broad Institute, specifically in building a trusted research environment where we can bring this multimodal data set that is actually being generated at scale here at M42 to ensure researchers can access to it in the right ethical and safe manner, and other government entities can use this data for the right purposes. So these are some of the key examples I can think from the top of our head where we're actually using AI-powered initiatives and partnerships to drive positive healthcare delivery in this region.
That's a very interesting snapshot in terms of public-private partnership. Broad Institute being academic, research-based, AstraZeneca, of course, being a major multinational. Anything more that you can share about how public-private partnerships are transforming this space through M42's experience? What comes next? What makes it successful when you're now very practiced in this? So just give us a glimpse on PPP in this era of health innovation.
I think the public-private partnerships is critical for large-scale initiatives that you want to take at an industry level, at a population level. Let me talk about, for example, the Emirati Genome Program. This is an example of an execution of an initiative between M42 and the Department of Health on a large-scale genomic initiative. During COVID, we worked together with the regulators to execute large-level clinical trials. So it's essential that if you want to make impact at a population level, it needs to be done together with the government, specifically on ensuring that we have the right resources working on that. We get support in understanding what's the right regulatory environment and how can we work together with the regulatory body to ensure that it's done in the right manner, but from a scalable perspective can be deployed for the nation. And fourthly, I think it's essential we use the public-private partnership to channel the right investment to drive the right use cases to ensure that the government sees a good ROI for their funding there.
And for the population's health, it sort of hits a specific target. It's very clear what each of these partners bring to the table. There are a lot of competencies, very unique competencies in each of those partnerships. How do you address the challenges of data privacy, security, and governance when you're actually building the AI and applying it to healthcare?
So
What are some
goes back to the
solutions?
yeah. So goes back to the fundamental points of ensuring transparency, which I mentioned. It's essential when we build AI models. We are transparent about how the models are. We ensure that we use the data sets in the right responsible manner with the regulators to ensure that it is certified and we can actually use these models in the clinical setting and ensure the patient safety or privacy is actually captured using the right mechanisms and following all the GDPR and HIPAA compliance so that it's used for the right purposes. Again, it's multifactorial and it's essential that we become exhaustive in all our approaches there.
What advice do you have to healthcare organizations looking to leverage AI and maintain a patient-centric approach?
I would say it's a good question. Now, and from our perspective, since it's within the ecosystem, it is an easy question to answer. Now, if it is just a healthcare provider, I think critical is partnership. It's essential. You don't need to build everything from scratch. Work together in a partnership to address the same problem. If together we can work in a manner that the models can be deployed and can solve large healthcare problems, it should be done together. So clearly, partnership is critical, and make sure it's focused. Choose the use cases that actually are impactful. For us, it's critical that we augment the healthcare delivery. For a different organization, maybe it could be a revenue optimization. There are a number of tools that we can deploy across that. It could be on automation. So choose the use case specifically and then address these models as opposed to a one-size-fits-all. I think that would be my advice.
And what are your thoughts on how the healthcare workforce adapts to using all this, not just learning, but actually finding new solutions? What is it going to take to get that piece of things into place?
It's a dual responsibility. It's one from the provider of actually educating the healthcare personnel or worker that this is not a tool that is going to replace you, but this is a tool that's going to augment your decision making. It's going to improve your productivity. It's going to improve your efficiency. It's going to improve the accuracy of your decision making. I have mentioned our tools in terms of large language models now. Initially, obviously, from a physician perspective, since we have them in our network, it was a challenge. But like I said, when we created squads that we had them embedded together with engineers, so they totally understood the benefits. So I think it's critical in terms of education. We are now living in a world of ChatGPT, which was not the case, say, 4 weeks back. So it's a continuous journey of continuously educating and telling them transparently what are the risks, what are the challenges, and collectively working together to ensure that this can be put into the healthcare delivery system that it focuses on the preventative, precision, and personalized medicine.
How does this apply globally now? I know, of course, that M42 has a global view on its innovations, its operations, but how does innovation that happens here grow out to spread around the world?
I think it's clearly through partnerships. One of our partnership partners is Microsoft, and we have a strong Azure partnership there. What our goal is to eventually build solutions on top of Azure and actually offer it to the world. So you would eventually have solutions or AI solutions specifically built in Abu Dhabi, but accessible to anywhere in the world. Take an example where specifically in certain developing countries where there is no access to a physician or a clinician to ask a particular question. Right now, you could actually ask those specific questions in terms of what are your symptoms, not again to sort of treat you, but to better understand what's going on. And this is the sort of model that I think soon will come, that you would have model as a service on top of a global infrastructure partner that can be offered to the world at a click of a button.
Abu Dhabi Global Healthcare Week is coming up. What are you most excited about? What key insights, experiences are you hoping to gain?
I think the entire ecosystem is super excited. Number one, it's the first version of the Abu Dhabi Global Healthcare Week. the lineup of the speakers and the conference are a true testament of how important this is. And as a foundation partner for this, we are super excited on bringing a large delegation of understanding the great work that Abu Dhabi is doing. To some of the points that we mentioned, it's an ecosystem that actually supports cutting-edge technology solutions for healthcare, built in Abu Dhabi for the world. And also we want to learn from the experts in terms of what they're doing across the globe. So we are super excited.
Any advice or recommendations for those thinking of coming to Abu Dhabi Global Healthcare Week?
I'd say pack light, because it's going to be a busy week here.
And one question we've been asking a lot of our guests on the podcast, when you reflect more broadly on the future of healthcare, what do you think is the biggest challenge facing the industry?
I think the biggest challenge right now is the shortage of healthcare workers. That's a huge thing. And we've seen that ever since COVID, right? We've seen a huge burnout of physicians, and that we are feeling the pinch right now. And we can see that there's a huge shortage of workers, not just in Abu Dhabi, but across the globe. And I think the goal is, how do we bring in solutions, technology solutions, to augment the current ones and also educate the ones that want to jump into the space. So clearly, AI and technology is the critical solution here that addresses this gap. Second, I think the biggest challenge is the increasing costs. Healthcare costs are continuously increasing. There has to be a technology solution that bridges the ever-increasing the jump that's been happening right now.
Ashish, this was fascinating. Is there anything else that you wish people knew about AI? You're a technologist who's become an innovator in this arena. I mean, what do you wish people understood?
I think there's a lot of fear and misunderstanding of what AI's capability is. But I think it's essential for people to start using it to understand for themselves. For some people, it would work. For some people, it won't. But start using it and use it for the right purposes. You don't need to change the world immediately with AI, but apply AI slowly in different aspects of life, and trust me, you would see a difference there.
If you could wave a magic wand and tell us what healthcare will look like 20 years from now, what's the best case scenario? What are you dreaming to see?
I won't wait 20 years. Maybe with the speed of technology, I would say maybe next year or in 5 years, when you're having this conversation, you would have everyone perhaps getting a 360-degree view of their own health. In the sense, you would have a device, an app, where it connects your wearables, you connects your electronic health records, your environmental data set, and you would have what works for you, and you would have virtual healthcare. At the click of a button, you could ask the right questions to a physician, and ensuring that you remain healthy and focused on health as opposed to visiting a hospital. So I think in future, at some point in time, hospitals will be used only for tertiary and complicated care. Primary and secondary care would be completely digital.
And preventive would have a whole new profile.
Absolutely.
Ashish, thank you so much for joining us.
Thank you so much, Laura. It was a pleasure being part of this wonderful podcast.
Thanks for listening to this episode of the Health Beats podcast. For more healthcare industry news, visit the Abu Dhabi Global Healthcare Week newsletter. The link is in our bio. And if you're interested in talking to us more, join us in person at Abu Dhabi Global Healthcare Week, taking place May 13th to 15th at ADNEC Abu Dhabi in the United Arab Emirates. Thanks for listening. Like, subscribe, and continue to follow Health Beats by Abu Dhabi Global Healthcare Week for your global healthcare industry digest.